we're going to get started here. Again, thank you for joining us. My name is George Huntley. I'm the Chief Executive Officer of the Diabetes Patient Advocacy Coalition. It is my pleasure to be hosting today's advocacy forum in the state of Oklahoma. We are delighted to be in the Sooner State today. So please, Jacob, if you could move the slide one more, we can kick this off with welcome and introduction. So I think I've covered that. Again, my name is George Huntley. I'm the CEO of the Diabetes Patient Advocacy Coalition. I'm a patient living with type 1 diabetes since 1983. Also have several family members with type 1 and also some with type 2. So it's both are in the family. I am also a past national chair of the American Diabetes Association, and also in my other day job, the chief operating officer at a professional services firm based out in Indianapolis, Indiana, where I have been the plan administrator of a self-insured health plan for over 20 years. As we get into this, we're going to have a panel on Oklahoma legislative overview and have some good panelists and good discussion there. We're then going to talk about Diabetes Advocacy 101 and walk everybody through some of the key issues impacting folks at the state level and talk about how to be a Deepak champion and how to be an advocate. And it's not that hard, even I can do it. And we're going to do, wrap up next steps. So, if you have any questions for the presenters, please hit the Q&A feature at the bottom of the panel, and we'll be sure to get them to you and to those panelists. If you're having technical difficulties, also go to that same spot. The meeting is being recorded, so I'll be on my best behavior today. Hopefully you all know where the restrooms are since it's a virtual meeting, and sit back, relax, and we're going to get into the program. So let's talk a little bit about who is Deepak. Our mission is to ensure quality and access to care, the devices, the medicines that a person with diabetes needs to be successful in living with this disease, and to also educate and empower and inspire patients and legislators to make meaningful and take meaningful action on behalf of people with diabetes. So we train the diabetes community, and we train legislators in the process as well. And today it's hopefully a good step in that direction. Deepak is also affiliated with the Diabetes Leadership Council, which I am also the CEO of the Diabetes Leadership Council. The Diabetes Leadership Council is an organization of everybody on that board is a past leader of a national diabetes organization, and it is a policy shop. So we go deep dive on advocacy and diabetes policy, and then the Deepak Army gets involved in hopefully affecting that policy through direct advocacy. So let's talk about the Oklahoma legislative overview, and we're going to start with a scorecard that we do. Now, Deepak does this in several states. We've done many of these so far. I have to start off by saying this is the best scorecard of any of the state forums we have done. There are a number of check boxes here. One of the key check boxes is the second one, the Diabetes Caucus. Oklahoma is one of the very few states that has a diabetes caucus. And when you have a diabetes caucus, this is a group of legislators. And in the case of Oklahoma, there's also several other interested parties in the healthcare arena that get together and work on diabetes issues at the state level. And this group is powerful because they work together. This is both sides of the aisle. And that's why you're seeing so many check boxes on here. This is the only state that we've done this where there are that many checks on the box. And the briefcase that you see on rebate pass-through, that means there is an active bill engaged in this session on rebate pass-through. We're going to talk a bit about that during today's program so that you all understand what that means. But you should feel good about the effort of the legislators, and Senator Hicks is on this call that will be on our panel. She's been engaged and involved in many of these bills, as have many of the folks on the Diabetes Caucus, and we're proud to support that effort. So we're going to kick this off. I'm going to now introduce and invite Ed Hawthorne to unmute himself and turn on his camera. Ed is the COO and Managing Director for CE3 Solutions. He is also the vice chair of the Diabetes Leadership Council and also a past national chair of the American Diabetes Association. And Ed is kind enough to join us to moderate the panel on Oklahoma state government. So Ed, thank you, welcome, and appreciate you joining us today.
All right, well, thank you, George, and we are going to get going with this, and we're so grateful to have with us today sort of a huge champion in the General Assembly for people with diabetes and other chronic conditions. And today we have Senator Kerri Hicks, and we were going to have Representative Marcus McIntyre, who unfortunately could not join us today. Senator Hicks was elected to the Oklahoma State Senate in 2018, where she represents Oklahoma City residents in the 40th District. In the State House, she serves on the Senate Health and Human Services Committee, among 4 other committees. She earned her bachelor's degree in mass communications and political science from Oklahoma City University, and later went on to earn a master's degree in early childhood education. A former teacher, Senator Hicks now runs an Oklahoma City nonprofit focused on early childhood education and quality health care. So the first question that I'll get for you, Senator, is that everyone has some connection to diabetes. So can you tell us about yours and why this is so important that you work on this particular issue?
Absolutely. Well, I'm just thrilled to be here today. Thank you so much for having me. Our connection to diabetes is really, really personal, as I would assume most folks' connection to diabetes is. My son, at 17 months old, started exhibiting what we know are now symptoms for diabetic ketoacidosis. Unfortunately, we didn't have that knowledge at the time because our family has no history of type 1 diabetes. And so at 17 months old, he was diagnosed with type 1 and the learning curve began. And I think at that point, it just really highlighted that because, we have support, resources, and insurance coverage, our son survived. Many of the stories that we've heard in recent years, the child didn't make it because, it's just a lot of folks don't have access to the resources and the support necessary. And so we're honored to share our story because obviously it does have a happy ending. He's coming up on his 8th birthday, but the challenges and struggles that we've had as a family and just making sure that we have access to the devices, access to treatments and therapies, and ongoing just management 101 for type 1 is incredibly expensive. And being a teacher in Oklahoma, obviously we had to make some pretty difficult decisions as a family in how we were going to be able to afford his medical necessary treatment. So a lot of our experiences have informed my work here in the state legislature and looking at what we can do at a state level to make sure that folks with chronic illnesses such as diabetes are able to afford their medications and have access to those treatments.
Yeah, it's unfortunate about your son with diabetes, but also your work in terms of helping people with diabetes allows you to speak from a personal perspective and firsthand, which is very powerful. So, well, thank you for sharing your story. So you've sponsored legislation that has promoted access and affordability for people with diabetes in various ways. You've also helped drafting legislation to require rebates passed through to patients at the point of sale. Can you tell us more about House Bill 4087 and its impact for people with chronic conditions and its status as of Thursday's legislative deadline?
So I'm going to back up just a little bit, just to kind of shine a light on some of the work that we have accomplished to this point. So, that scorecard was really inspiring because, there's a personal story to each one of those check marks on the box. So when I was elected in 2018, the very first bill that I was able to run is Kevin's Law, and that provides emergency access to insulin and lots of other medications that are classified as life-saving medications. Obviously, with diabetes, it's not reversible yet. So if you are prescribed insulin and for whatever reason your prescription expires and you're not able to contact your healthcare provider, and just kind of the ongoing hurdles I think that we all go through each and every day to make sure that we have our supplies well stocked. This bill that we passed in 2018 allows emergency access. So that was step number one. Since that time, we've actually been able to get copay caps passed, and this afternoon I'll be running a cleanup bill to the copay caps bill that we passed last year. The language currently says insurance carriers, and there's a debate over semantics from the insurance companies who classify themselves as insurance providers. So Senate Bill 861 will be heard this afternoon, and it just clarifies that it's all health benefit plans that are regulated in the state of Oklahoma, so that patients who do fall under that classification are getting that insulin at a 30-day supply for $30, 90-day supply for $90. The other thing that we've been successful with the Diabetes Caucus is getting CGM coverage, continuous glucose monitor coverage, for our youngest type 1 and type 2. On our Sooner Care or Medicaid system for children. There was a lot of folks who were experiencing disruption. We have a large military community, and if folks are transferred in and transferred out, other states have this coverage, and we did not provide that. So that was a major victory in knowing that maintaining glucose levels is hard at any age, but especially whenever it's tiny people who can't always verbalize what's going on in their bodies. It gives parents and their providers or their caregivers better information to be able to manage those highs and lows. So the rebates reform bill that's currently being considered right now is exciting. I'll just say that it has taken a lot of education to get the lawmakers up here to understand exactly why this is necessary. There's a large and loud lobby against this particular measure, just based on profits. And so making sure that we're able to cut through the noise and really understand the complexities, of what's happening within that coverage and the rebates system as it's currently being implemented. So the rebates pass-through bill ultimately gives those rebates back to the consumer at the point of purchase, the point of sale. Currently, those go back to the insurance companies, and they claim that it helps keep their I guess our monthly premiums low, but ultimately the cost of diabetes is extremely high for those of us who pay 2.3 times as much annually for healthcare. We expect to pay more. That's a given, but the fact that it's being used to subsidize everyone else's health insurance plan is it's not right, and it's not fair. So I'm inspired. I'm encouraged. I'm thankful that this is a bipartisan effort. Representative McIntyre is carrying that bill in the House. And unfortunately, during session, it's really hard to know what the House is doing when you serve in the Senate, because I don't always know what the Senate is doing, and I'm there. So I'm not sure if it's on today's agenda or if it's when it will be considered this week, but we do have a floor deadline this week. So I would assume that we will be hearing that bill moving forward, and I look forward to being able to support it in the Senate.
And your level of optimism, is it high? Is it? What do you feel? What are you feeling about it?
Oh, you just never know. That's unfortunately the politics side of things, right? So I always say, there's two facets to anything that we do up here, and that's policy, which, and in my opinion, is the easy part of just, it's straightforward policy. You've done your research, you understand the assignment, but then, the politics that, oftentimes are behind the scenes. So you're trying to figure out why or who and how, to make sure that you can get good policy through the process. So your guess is as good as mine at this point. Serving in the super minority, they don't often let us know what's going on. So we'll wait to see. And I'm an eternal optimist. So I think that's, the way to approach our work is being hopeful that we can pass good, meaningful legislation that will impact so many Oklahomans.
Well, so is the army of Deepak advocates. So if we can ever come to your aid and help, if there's things that we can do, you call on us as well. I also wanted to thank you for calling out the military community there in Oklahoma and making sure that they're top of mind as well. I actually served at Fort Sill, Oklahoma myself. So
thank you so much for your service. We appreciate that.
well, thank you. So now I also know that you serve on committees that are focusing on the health of all Oklahomans, and where you're working with colleagues from different parties and different areas of the state. Could you speak more broadly to some of the health priorities for your committee as well as your caucus, and what they might mean for the chronic disease community?
Absolutely. It sounds like a broken record, but we haven't fixed it yet, right? So, it's no secret in Oklahoma, we have some of the worst health outcomes nationwide. And so, our caucus is still committed to making sure that everyone in the state of Oklahoma has access, number one, and that it's affordable. And so, we've had rural hospital closures, we've had lots of disruptions, obviously, due to the pandemic, and we've got a workforce shortage. And so I think there are a lot of ways in which we do have some exciting opportunities through ARPA funding, federal funding, to be able to try and invest to really build out some better pathways to make sure that folks, regardless of income, regardless of location, that everyone has equitable access to healthcare. I serve in a very urban district in the heart of Oklahoma City, in the heart of our state. And so, when I think about the healthcare decisions for our family, it's really concerning that, our options are limited as far as where we would choose to live. The endocrinologists are obviously all in large metropolitan areas here in Oklahoma City and in Tulsa. And so that's a major concern for our family, and looking at how we would have access to those ongoing appointments for the A1C checks and just all of the different screenings that are necessary in order to take care of his chronic illness. And so really thinking more broadly about what services are available to communities statewide. Another top priority for me personally is on maternal and infant mortality, and so I've ran several bills, a couple that are advancing this year, that really look at some of those health disparities in making sure that everyone has access to prenatal and postpartum coverage to make sure that moms and babies are healthy.
Well, thank you so much. And speaking of, disparities in health inequities, it's been well reported that COVID, as well as diabetes, has had a disproportionate impact on certain segments of the population, generally referred to as health inequity. And how are the leaders in Oklahoma working to address this for impacted community, especially those of color?
Yeah, I think we hear a lot about social determinants of health. Unfortunately, there's been a lack of action to really address those root causes that we know exist. And I don't think it's fair that your zip code determines your life expectancy. I think that's pretty damning as a state, that we would allow such disparities to exist. And so, I really think that Medicaid expansion has been a massive lifeline during COVID, as far as folks being able to have access to screening and vaccinations and regular healthcare and appointments. But we did get an update yesterday that highlights what you're talking about as far as racial disparities. I think to this point, about 60% of the expansion population are white. So, I mean, it kind of is a myth buster, in that folks who are against Medicaid expansion were saying, using some really outdated language and terrible assumptions about who would be benefiting from that expansion population. And so, the reality is we haven't done near enough. Folks up here are unfortunately not close to the situation. I think proximity matters when you're talking about addressing some of these systemic issues. And so it's unfortunate that everyone has to get uncomfortable in order for us to really do some meaningful changes to the systems and the way that in which we operate. So, I know that I had a really good meeting yesterday with actually one of the secretaries of the Health and Human Services in the federal government, who was talking about this exact thing, and looking at doula coverage and some other ways in which we can really start to kind of bring some equity into the conversation.
Well, myth busting is like the first point of getting people to understand the true facts, right? And so I think that's a huge place, because there is this misconception about who benefits from some of these programs. And when I talk about like communities of color and your response, that include the Native Americans in you have a pretty large population of Native Americans. Is the issue the same? Is it different? How you're addressing it is the same or different?
Yeah, I mean, our tribal partners are literally what keeps the state afloat. Honestly, when it comes to health conversations, our tribal nations have done an incredible job of expanding into rural communities, and are oftentimes the only healthcare providers in rural communities. And so I think it goes without saying that, as abysmal as our outcomes are currently, we would have much further to fall if it weren't for their support and their continued efforts to tackle some of these conversations. We do have a large presence of tribal members in the diabetes caucus as well, because of the large occurrence of type 2 diabetes in our Native brothers and sisters. And so, it's an important component. It's an important piece. And I'm so glad that you raised that, because, the Indian Health Clinic here in Oklahoma City are always at the table whenever we're talking about meaningful changes related to diabetes management, chronic illnesses, and really just equity and access.
Mm-hmm. Well, thank you so much for what you're doing, and you sound like just the right person to keep the issue top of mind and keep pushing at it, because it's interesting that things become top of mind for all of us, and then another priority happens and it just goes to the wayside, and sometimes it stays on the wayside for way too long and never gets addressed. So hopefully you'll keep that focus and keep it top of mind, and we appreciate it.
You bet.
So I have one last question for you, and that is, we would all like to know the best way that an advocate can help you and work with you to engage their own representatives. And we often hear that just a couple of people just writing letters can get lawmakers' attention. So I wanted to get your perspective on that for us.
Yeah, that's absolutely true. One of the best things I think about serving in the Oklahoma Senate is just how close we are to our constituents. And so, I mean, we might all come with different political philosophies, related to where we serve, but I just have to believe that, everyone that I serve with wants a better Oklahoma. And so, I mean, the reality is you can reach out to us. I give out my personal cell phone pretty much on a regular basis. I understand that not everyone runs their office the way that I do, but those relationships are really, really meaningful when you have someone who's experiencing an issue and they share their personal story. The thing to remember is that, we all come with our backgrounds, our baggage, if you will, and there are specific issues that we have, more passion behind, but I think we're always willing to learn, and definitely when it comes to the communities that we represent. So, if you don't know who your representative is, if you don't know who your senator is, it's very easy to navigate. You can just log on to oksenate.gov and put in your zip code, and you can find your legislators. Emails are wonderful, but face-to-face visits are also great. Especially, we're in session right now, but we have Fridays off to go back and serve in the district, and so Friday coffees are wonderful, just to make sure that I like that time to make sure that I'm connecting back to the community and representing them well, their voices well, on the issues that we're discussing here at the Capitol. But the kind of process of creating policy and passing bills, let me just kind of fill you in on that timeline. So we are currently in session. It goes from February until May. Once we sine die or adjourn for the session, then everybody kind of needs a break. It's kind of like family. We've been together too long. And people kind of check out, during the month of June. But I also, I just joke that it's kind of like teacher brain. You take the month of June to just recover, and then by 4th of July, everybody's brain kind of snaps back into focus. I'm like, okay, what's next? So we have interim studies that we can propose. The deadline is usually right around the 4th of July when we find out whether or not those are accepted. And interim studies can be on a variety of things, whether it's policy that you ran that failed, or you truly just don't have any policy in mind and you're trying to figure out what to do about a specific issue. Once those are approved, then you have to get the chairman's buy-in. It'll be assigned to a committee, and the chairman will decide whether or not they want to hear the interim study. So all that to say that the months of July and August and September are really kind of the fact-finding times for lawmakers and figuring out what kind of legislation they want to file, what the bill might look like, including people in on the conversations. That's another perfect opportunity to just invite your legislators to coffee, or see them in the district. And by November, we start to have some bill deadlines, requesting titles of language. That is the first hurdle in the Senate. And then right around Christmas time is when we hit our deadline for having the substantive language in the bill. So that just kind of gives you an idea. When people reach out in March, at this point in time and ask you to run a bill, we've already passed too many deadlines at that point to be able to get something of substance through the process. So, start early. The first step.
So those critical months that you mentioned, I'm sorry, those critical months that you mentioned for us as advocates, that's really the time that we should be sort of, charged up, contacting our representatives.
Absolutely. And obviously November is Diabetes Awareness Month. So that's another great opportunity to just share your personal story. We are the experts of our lived experience. And I think there's so much power that comes with sharing your truth. The insurance chairman and I have not seen eye to eye on a lot of issues related to coverage for folks with chronic illness. But, to his credit, we sat down, and I think he shed a couple tears listening to our personal testimony and our story about kind of why I'm so passionate about this particular issue. And now obviously all the members, they know our family, they know our son. And so it really gives that tangible connection to what we're trying to accomplish, not only for our family, but for all Oklahomans. And there's just so much power in having that personal attachment and that connection that if you're a lawmaker, if you have the time to meet with your lawmaker and share that story, it will absolutely inform the way that they vote on issues. When you do reach out and say, hey, support this bill, they'll remember you. You know, and we get so few constituent emails on specific issues, especially on healthcare. The majority of that volume comes from, you know, auto-generated, you know, special interest groups and organizations, which I mean, I still enjoy getting those. But if there's an email that is heartfelt and genuine, that is worth its weight in gold, because I want to make sure that I respond personally to that.
Well, Senator Hicks, thank you so much for being a champion for the cause of diabetes. Thank you so much for all of the work you do and for sharing your personal stories, and for the time that you spent with us today and all that you do to make the lives better for people living with diabetes and other chronic conditions. So I will turn it back over to George.
Thank you. Thanks, Senator. Thank you so very much for being with us. It's always a pleasure to work with you, but thank you so much for joining us today and sharing your perspective. That's so appreciated. Everything you've done for people with diabetes. God bless. Thank you.
I appreciate you all. Thank you again for having me.
Thank you. And thank you for moderating the panel.
All right. It's my pleasure, George.
Much appreciated. So we're going to move on, guys, now to talk a little bit about the legislative process, and give a quick snapshot overview of Oklahoma's political and legislative structure. So in the U.S. Congress, we've got 2 senators, both Republicans, and the entire congressional delegation is Republican. 5 representatives also Republican. Of note, we talked about the Oklahoma Diabetes Caucus. There is a federal Diabetes Caucus, which is the largest caucus in the legislature, with 306 members. And there is power because it's one area where people can come together. So it's important to note that this caucus is really important at both the federal and the state level. At the state level, Oklahoma is one of 22 supermajority legislatures, where you have the Republican governor, a Republican-controlled Senate, and a Republican-controlled House of Representatives. So this is an area where the Republicans are controlling things, and you have to work across the aisle if you're in the blue side of that equation. But only one of 22 states that have this supermajority. So let's talk about how sausage is made. We all remember Bill on Capitol Hill, but a bill becomes a law by getting through both chambers, the Senate or the House, and then they have to get to signed by the governor. So it starts with a sponsor filing a bill in whatever chamber they happen to be in. That then gets taken by chamber leadership, Senate leadership, House leadership, and assigned to a committee. The committee chair has to allow that bill to be heard. So sometimes you have to advocate to even get the bill heard at the committee level. And you will see sometimes Deepak will send out alerts to say, please ask the chairman to actually hear the bill, or please ask the committee to vote on it. Once it gets out of committee, it goes to the chamber floor, again, House or Senate, to get voted there. Once it passed that chamber, and there are deadlines to get past one chamber before it flips over to the other, then it goes to this next chamber, and it again gets assigned to a committee there, has to get a vote at that committee. So it can, and any one of these blocks can block a bill. So you've got to get all the way to the end zone past that second chamber, and the governor then needs to sign it into law for it to be actually enacted. So the number of bills that actually make it to that final block are few. It does take a lot of work to get there. So let's talk a little bit about Advocacy 101 and how to become an advocate. So step one is, what is a champion? And, I wish everybody had a mirror in front of them, because if you had one, you'd look at that mirror and you'd say, gee, you are the champions. A champion is a trained advocate. And it then becomes a community of trained advocates, people with passion, trying to get something done on behalf of patients, on behalf of people living with diabetes. And so one turns into 10, it turns into hopefully hundreds. We invite you to take action. We ask you to invite friends to join us, follow us on social media, help grow the pack of champions so that our voices are amplified. And we have, through Deepak, champions, grassroots advocates everywhere. They're in every state in the union. We're thousands and thousands and thousands strong, which is really super. So when something comes up in Oklahoma, we have dedicated advocates, and now everybody on this call, we are all together in this. And every state in the union, we have groups of dedicated advocates.
To me, like George, that all the diabetes organizations need to get together as a group and put forth something that says what needs to happen to help people with diabetes.
That would be a really good idea, and the great
Hey, let's do it.
We did it in back in 2020, heading into the federal election. Deepak and the Diabetes Leadership Council worked together with 12 national diabetes organizations to create this consensus statement on U.S. healthcare reform for people with diabetes, specifically looking at it through a diabetes-focused lens. It's an excellent report. Kudos to Erica Emerson, our Chief Policy Officer at DLC, for her leadership and typing on this one too. But if you are interested in learning more about what can be done at the health reform, please go to diabetesleadership.org and download this consensus statement. It's good reading that will continue to tick you off. And as advocates, being ticked off, I think, is a good thing. There's a lot of opportunity for us to improve the U.S. healthcare system, and a lot of things on here can be done at the state level as well.
So, George, as I read through our notes before this call, 63% of the people out there say they don't have experience on how to advocate with their member of the legislature. So if I'm one of those 63%, how do I start advocating? How do I start getting involved? And I don't have a lot of time. I've got a family. I've got a job. I don't have a lot of time. What can I do to help?
So the step one, and excellent question, is become a Deepak champion. Please go to the diabetespac.org website and sign up. It's very simple, very easy, and we don't spam you. We only send you things when there's stuff to do. Take action at the state and federal levels when you get our emails. Warning, this happens at government pace. As you heard Senator Hicks speak, the hot time for voting on bills is about now. It's about February, March, April, ends in May. So getting things done is right now, and then it's quiet. There's not a bill to be thinking about over the summer from a please vote on it, but there is a lot of thought that happens in the summer to talk to your legislators. So step one, just please sign up and pay attention when these emails come through. And then join us for other events. We do brown bags, lunch and learns, where we go deeper into some of the topics that we barely touched on today, so that you can understand and empower and educate the advocates and help us grow in that. We'll do policy briefings, and follow us on social media, please. At Diabetes Pac, we're on Facebook, Instagram, Twitter. Please follow us and help us spread that message.
So, George, all right, so I'd sign up. I get an email. Can I just hit click? Can I just get the email and hit click and put my name in?
You can, but I would urge you not to. My urge you is, you see that little bottom part there? When you click through and one of our action alerts, this is what you're going to see. You're going to see the letter there that's crafted. This one's going to Senator Adam Pugh, and it talks about the issue. And this one is specifically Senate Bill 1324. And we please, when we're done, click through and go do this. But where it says show more, add a personalized message. tell the senator, tell your representative why this is important to you, why diabetes impacts your life. This particular bill, rebate pass-through, this is every drug out there. This is not just an insulin bill. This is not just a diabetes bill. This is every branded drug out there. Oklahomans are paying nearly double what their insurer is paying for these drugs. And this is happening across the country. This will help Oklahomans be protected from it. So please add your personalized message. It does mean something. And you heard also Senator Hicks talk about how infrequently people talk to her. And she's an engaging, nice person. People should be talking to her a lot. She's a delight to talk to. So I would urge you to reach out. They really don't hear from their constituents nearly as much as you would think. And you're not bothering them. It's their job to listen to you. And so please take advantage of that. You'll learn, and so will they.
George, before I let you close, and that's your job, of course, is to be the open and the close. I've been doing this a long time. I've been to Oklahoma. I've been to almost all 50 states advocating for diabetes and people with diabetes. And I want to leave this message, if I can, very quickly. Ladies and gentlemen, if not you, who? If not us, who? We have got to stand up and fight for what's right for people with diabetes. We've got to stand up for your relatives, for your friends, for your family, for your coworkers on what's right with diabetes. The big insurance companies, the big deal, they've got lots of money. We don't. It's time for us to stand up and be counted for people with diabetes. No one should ration insulin. No one should be without their medications. No one should be unable to afford to go to the doctor. No one should not have access to those things. Ladies and gentlemen, stand up and do what's right. George, thank you very much for all that you do, and thanks for giving me an opportunity to vent.
Thank you, sir. I greatly appreciate it. I'm just going to drop the microphone on that. Thank you for your time, everybody. Really appreciate you spending your lunch hour with us. Hope you got something out of this. Please sign up to be a Deepak advocate. Please follow us on social media, and please share this opportunity with at least 10 friends and families. Help us grow in Oklahoma specifically. Thanks so very much. Have an awesome afternoon.